So we'll go to the next group, in which is the L sound, and that is tongue to teeth. So when people say L, usually the tip of the tongue is at the lower end of the cingulum area on the upper teeth. And, you know, the L sound is formed, the lingual tip of the tongue contacts the lingual, the maxillary anterior teeth. Anterior teeth that are placed too far forward or too far lingually can affect this sound. So how do we correct it? Acrylic, as you see in the bottom picture, can be or on the top picture, can be added to the facials of the teeth or the linguals of the teeth, like you see on the bottom picture, to correct the sound. And that all depends upon what position the teeth are in initially. If the patient needs to have the teeth brought lingually or a little more bulk added so that their tongue can find the L sound, that's what we can do. And then shape, you know, after we add, we do some shaping to make the sound even better. Or we can add acrylic to the facials of the teeth if the incisal edge position needs to be more forward. We can also add acrylic to the lingual of the teeth and bring the incisal edge lingually if we need to, as you see in the bottom picture, which I talked about. And that can be corrected. And I, you know, work with doctors chairside with this, and we go through these exercises, and right in front of your eyes, you can see this patient start to talk better, start to make their sounds better. And one thing that I have to mention also with this is quite often vertical dimension plays a part in this too. So along with the sounds that we're going to try to correct here, vertical dimension, if it's not in its correct position, can cause speech problems simply because the tongue doesn't have enough room to move, as we talked about earlier in the discussion. If you suspect that the teeth are too far to the facial, as I said, add composite or acrylic to the lingual of the teeth, and just slowly develop this L sound with the patient.